More than 50 medical, nutrition, and nursing students from the University of Virginia toured Charlottesville area farms and enjoyed local foods at a farm-to-table educational event last month. While giving students a chance to learn how local foods are produced was an important aspect of the tour, the real lesson was that even healthcare professionals are confused about accurate nutritional advice.
We live in a country that is obsessed with food. We eat a lot of it. We talk a lot about it. We watch a lot about it on television. We are constantly reading about it. But unfortunately, this din, this cacophony of messages about food, about nutrition, about health, often has the effect of making people confused, uncertain, and sometimes we just give up. So it's particularly important that we train nutrition professionals who can not only wade through all of these messages themselves, but can translate this in clear and simple ways to their patients, to their clients, to Americans more generally.
Students toured a local organic produce farm, a UVA education garden plot, and soybean fields at Morven Farm. They talked with growers about what it takes to successfully bring foods to consumers. They also heard about the challenges facing soybean growers and fruit producers.
To have those farmers available to us to ask questions to show their compassion for what they do really does translate to us clinicians who are super passionate about what we do.
Future medical professionals learning about farming was one aspect of the tour. However, a lack of clear and accurate nutritional advice was the other side of the coin. Medical professionals are considered top sources of good nutrition advice based on public opinion polls, but most are as confused as the mainstream public. But there are helpful websites.
Social media will not necessarily tell you what's healthy. There are definitely different sort of websites that are true and trusted, like the USDA. MyPlate is an excellent resource. So is the American Heart Association. There's also eatright.org, which is the American Dietetic Association. Those are your trusted sources. If you just plug in as key search words, food, eating healthy, organics, you're going to get a lot of hits, and that some of it is not going to be credible information from individuals who are well trained.
And I was actually talking to some people during dinner about how nutrition is such an important part of all of our lives, and as physicians and nurses, a big part of our job is to educate our patients on nutrition. But in my 4 years of education, I will have absolutely zero nutritional training.
It's really important not just to find ways to teach the teachers about food and nutrition, but to do something so basic as getting them out onto a farm and letting them talk to and hear from farmers. What we know is that most Americans, most of the time, take their food for granted. It's everywhere, and yet most of us don't really understand where it comes from, who produced it, who grew it, how it got to them. And a real appreciation of the role of food in our lives requires us, every once in a while, to meet a farmer.
The tour, meal, and panel discussion on how to give patients sound nutritional advice was sponsored by the Virginia Farm Bureau Federation and the University of Virginia. The objective was to build bridges between farmers and medical professionals who all share the same goal of healthy eating habits for everyone. Reporting from Albemarle County, I'm Sherry McKinney.